Welcome to Module 15 of our Advanced Wound Care Training Series. In this session, we'll explore two of the most critical and emerging topics in wound management: antibiotic stewardship and biofilm management. These concepts are vital in improving healing outcomes while curbing the growing threat of antibiotic resistance. Let's begin. By the end of this module, you should be able to 1. Explain the concept and importance of antibiotic stewardship in wound care. 2. Distinguish between colonization, local infection, and systemic infection. 3. Describe the formation, structure, and clinical impact of biofilm in chronic wounds. Apply evidence-based strategies to manage biofilm and reduce antibiotic misuse. 5. Support interdisciplinary approaches to prevent resistance and promote healing. Antimicrobial resistance is not a future problem. It's a current global health crisis. In wound care, antibiotics are often overprescribed, especially in situations where a wound is colonized but not infected. This leads to avoidable resistance, unnecessary side effects, and inflated treatment costs. At the same time, many chronic wounds are affected by biofilm, a hidden barrier to healing that resists both the immune system and most antibiotic therapies. This module will equip you to critically evaluate when antibiotics are truly needed and how to tackle biofilms effectively. Antibiotic stewardship involves using the right antibiotic at the right dose, for the right duration, and only when truly needed. As nurses, you are frontline decision makers and influencers in stewardship. Your role includes avoiding antibiotics based on odor or colonization alone, promptly obtaining wound cultures before antibiotics are initiated, recognizing true signs of infection, documenting wound changes meticulously, educating patients about adherence and the consequences of antibiotic misuse. These actions collectively ensure safer, more effective wound care and help preserve antibiotics for future generations. Stewardship isn't about restricting care, it's about optimizing outcomes. We aim to achieve optimal patient recovery, minimal resistance, fewer side effects, cost-effective treatment. Remember, colonization is the mere presence of bacteria, which does not require treatment. It's infection, especially spreading or systemic infection, that warrants antibiotics. And systemic therapy must be driven by clinical signs, not just wound appearance. Avoid the common trap of using antibiotics as a substitute for wound cleansing or debridement. This slide shows us when antibiotics are warranted and when they are not. Antibiotics are not warranted for colonized wounds without signs of infection, odor alone, presence of slaw without inflammation. As a replacement for wound care, antibiotics are warranted when we see localized signs, erythema, increased pain, heat, delayed healing, spreading signs, cellulitis, lymphangitis, systemic symptoms, systemic infection, fever, tachycardia, hypotension, leukocytosis, complications like osteomyelitis or abscess formation. As clinicians, we must differentiate colonization from infection to avoid misuse. Nurses play a pivotal role in antimicrobial stewardship. Here's what you can do. Assess wounds using tools like NERDS and StoneEase to validate the presence of infection. Use proper techniques for wound cultures, preferably the Levine method or tissue biopsy for accuracy. Avoid requesting antibiotics for every wound with odor or slough. Monitor treatment outcomes. Is the wound improving? Are there new symptoms or side effects? Recommend alternatives like topical antimicrobials or timely debridement when appropriate. Let's shift focus to biofilms, a major yet often overlooked barrier to wound healing. A biofilm is a structured cluster of microorganisms surrounded by a self-produced matrix that adheres to the wound's surface. It acts like a shield, protecting bacteria from both the host immune system and antibiotics. Biofilm can delay epithelialization, cause persistent inflammation, make wounds appear stuck in a non-healing state. Up to 80% of chronic wounds contain biofilm, and antibiotics alone cannot eliminate it. How do we suspect biofilm in clinical practice? Look for these signs: a non-healing wound despite standard care, shiny or slimy wound surface, especially if recurrent, persistent odor or exudate, returning after dressings are changed, fragile granulation tissue that bleeds easily, slough that doesn't respond to cleansing or basic debridement. If you see these features, assume biofilm may be present and act accordingly. Biofilm cannot be eradicated by antibiotics alone. We need a multi-step approach. 1. Debridement is essential. Sharp debridement is the gold standard for removing biofilm. It should be repeated every 3 to 7 days in chronic wounds. 2. Wound cleansing with surfactants helps reduce microbial load and biofilm reformation. Choose agents that are non-toxic and compatible with wound tissue. 3rd, topical antimicrobials like silver, iodine, PHMB, or honey dressings should follow debridement. Rotate products to prevent resistance and limit use to 7 to 14 days. 4. Adjunctive therapies such as ultrasound-assisted debridement, negative pressure. Wound therapy with instillation or topical oxygen can be used under specialist guidance. Effective biofilm and infection control requires a structured plan. 1. Suspect infection. Use your clinical tools and holistic assessment. 2. Confirm the diagnosis, culture, imaging, or labs as per protocol. 3rd, start treatment. Begin with topical or systemic therapy based on findings. 4th, reassess, monitor wound healing, pain, signs of spread, or adverse effects. 5, evaluate. If no improvement in 2 to 4 weeks, escalate to a wound care specialist or advanced care center. Education is a cornerstone of stewardship. Teach patients and caregivers. Not every wound needs antibiotics. In fact, overuse can delay healing. Complete the full course of any prescribed antibiotics. Maintain clean wound care, use proper dressings, and monitor for reinfection. Control comorbidities, especially blood sugar, to support immune function. Empowering patients reduces dependence on systemic medications and supports faster recovery. To conclude, antibiotic stewardship and biofilm management are not just physician responsibilities, they are essential nursing competencies. By integrating proper assessment, critical decision-making, appropriate use of antimicrobials, and debridement practices, we not only enhance healing, but also protect our patients and society from the growing threat of resistance. Together, let's lead responsible wound care through education, collaboration, and evidence-based practice. Thank you.